It's a real pleasure to be here with my good friend Dr. Shane Reti and the great MP for Whangarei, and obviously to be here as we make an announcement about a cancer radiation facility for the north. And as you know so well, there are so many people here spread over a large area, and actually the huge amount of travel times that they take going down to Auckland to get their cancer treatment will be remedied through this investment. So we're really excited to be here. Obviously we know we've got a lot of work ahead of us in the healthcare sector in general, but it's really exciting to be able to get this announcement done and out of the way. Obviously today is also the end of our 100 days. We have completed all 49 actions that we set out to implement over the first 100 days. It has been incredibly helpful to focus the public service, but also to focus our government to say let's work on the most important things first and keep making progress for the New Zealand people. We are a government that is here to get outcomes, to get things done for people, and that's why we are so focused on action and delivery, and we'll continue to do so. With that, happy to take your questions.
You've announced these health targets today, including targets around cancer treatment, but how are you going to actually achieve that?
Sure, let me pass over to Shane.
Sure, look, thank you very much. So there are three key enablers to reaching these targets, and as I said, some of them like elective and planned care, they were hard for the previous government. You know what, they're going to be hard for us too. So several things to that. First of all, workforce. Workforce is a key enabler, and we're needing to do more with the workforce. Secondly, a lot of the targets, particularly ED and elective targets, they do suffer from bed block. That is, you can't move a person from ED up to the ward if the wards are blocked. So in this calendar year, we'll bring on stream over 100 inpatient beds and bring on stream 8 new operating theatres as part of the infrastructure to help us meet those elective and planned care objectives and to be able to move people through the hospital system. So those are the three key ways: workforce, targets clearly, and infrastructure to help us achieve this.
What about those cancer treatment targets in particular? Do we actually have enough oncologists working in the public sector to enable us to meet those targets?
Yes, this is a good question that we were raising with the domain experts here today, because we know down the South Island, radiation oncologist, has been a challenge in the South Island. So what they're looking at new models of care whereby the initial strategy and the clinical plan is set by one of the hubs, maybe in Auckland or Wellington, but the actual deployment, the giving of the radiation is done out in the centres. So new models of care will help us with that, but it is a workforce that is constrained and needs more support, that is correct.
How soon do you expect to meet these targets?
Look, we'll set annual targets, so we'll have annual milestones, if you would like, towards those targets. Some of them we're just looking to, I would describe it, stem the bleeding. ED wait times, it just continues to track down. So, you know, if we can plateau out for 3, 4, 5, 6 months, that's a good outcome, actually. So we'll have milestones every year to guide us to know that we're on track or not.
So what will you do if progress meeting those targets is too slow?
We'll just do better. We'll find out what enablers are failing us, whether we need to do more with workforce, whether we need to do more with infrastructure or patient flow. There's a number of things that we'll do to keep ourselves on target.
What about GPs? Because we know that that's a pressure point. Are you going to address that, and why wasn't there a health target for primary care?
There is. Immunisation is a primary care target, and that's the key thing I would say to primary care. If there's one of these targets to do well, please do immunisation. And you heard me say that the Prime Minister and myself are very concerned about a measles outbreak. So our message to primary care is you have a lot of things to do. We get that, but please do immunisation really well.
How will the targets actually help people access the services they need?
What targets do is they focus attention, they focus accountability, they focus resources. And we know when the focus on the targets was removed with the incoming government in 2017, amidst a range of other factors, but targets probably had a role to play in those falling metrics right from that time, and as I said in my speech, before COVID arrived actually.
Will there be an equity element with these targets? Are you going to target specific demographics differently to make sure that everybody's in the same?
So I mentioned that in the target around cancer, that one of the things we're going to need to work on really quickly is the regional variability, if you like. So that's equity of demography, if you like, because it's quite widespread, including here, actually, in Northland. So within those targets, we'll figure out how we can target those areas, particularly that are the outliers and that are the laggers, to bring them up to where the average and median may be.
What about for Māori and Pacifica?
Yeah, across all of those targets, Māori and Pacifica do poorly, actually. Particularly, and I don't want to sort of harp on about measles, but particularly for measles, we are deeply concerned, and we talk about this quite frequently, about the impact of a measles outbreak for Māori. So just Wednesday, I was speaking to Māori partnership boards and bringing them into the fold around what a new health system might look for them. They were very encouraged, and I pointed them towards immunisation as well.
I think a good example on that would be the $50 million investment that we made before Christmas, where we're actually working with Māori health organisations to make sure we lift Māori health immunisation rates for under 2s are sitting at about 71%, 73% I think, and then the national average is about 81%. We've set a target of 95% by 2030, and obviously we've got a lot of work to do. But actually being able to power up Māori organisations that actually have huge standing in their communities can actually deliver those services in a much better way than doing it through a centralised bureaucracy is a good example where we have really good clarity. We want to lift that by another 5 points. We've got to keep driving towards lifting these goals and these targets. We won't hit all our targets, and we're going to implement them across all of our public services as well. But what we want to do is we want everyone to be focused on actually saying this is what is important to New Zealanders, this is what we're actually going to focus our organisations around and delivering these things. There's lots of complexity, there's lots of things always to do, but these are the big things that will make the most amount of difference to the most amount of people if we get them right. And so we know we're being ambitious, we know that we have got a lot of aspiration in here, we know there's a lot of work behind the scenes to get all the mechanistic bits and the root causes sorted in order to deliver against those targets, but we're going to do it.
With immunisations, obviously GPs are a crucial part of that picture. We've seen a GP clinic in Papamoa announce a closure today, citing lack of GP staff available and government underfunding. What are you doing about that and how are you responding?
So to the first point, there's a range of potential vaccinators that we need to increase the scope. For example, you've heard us talk about pharmacies. I mean, pharmacies give pertussis to pregnant women antenatally, for goodness sake. Surely they can give part of the immunisation schedule. So that'll be something we're not just looking at, we're already progressing. Plunket, for example, we need them to be vaccinators. Everyone from a health perspective who appropriately touches a patient on their journey who might be able to offer a vaccine, please, let's figure out how to credential them and have them doing that. The wider question you ask about primary care are issues of recruitment, retention and remuneration. From a recruitment perspective, I'm very encouraged by what is one of the largest cohorts of general practice registrars we've ever had currently out working in general practice. They'll do their 2 years GPEP time, and then they will be right there fully out with other GPs. So I'm encouraged by that. Work to do, clearly. Medical school, third medical school, again that long-term ambition to deliver that. And from a remuneration perspective, we're looking closely at the SPEAR report, which is widely accepted by primary care as to how we can do two things. One, redistribute the capitation pie so that where the work is done is where the funding goes to, attributes basically, and whether there's new funding as well. So we have all of these recruitment, retention and remuneration right in our headlights.
In terms of pharmacy vaccinations, there is some concern from GPs around people who receive their vaccine at the pharmacy missing out on that wraparound or that long-term care that you get with a GP.
Sure.
How do you feel about that?
But in the same breath, what they also recognise is they don't have the sort of hours that pharmacy may have, and so there will be some patients where actually access is going to be through their pharmacy. What I'd expect then is collaboration across the sector so that the pharmacy is reporting back to the general practice what they've given, the services they provided. There are some parts of the vaccine schedule, like the 6-week vaccine, that I think should be with general practice, because that's the postnatal check as well, and you're talking contraception, you're talking about a whole lot of other things, not just the vaccine. So working closely with primary care and GPs on that.
How
Do
will
you
it,
accept that in Northland, the general practices in Northland have been historically underfunded and are one of the ones that are going to need a boost?
I accept across the whole country that there's a need to be focusing on recruitment, retention and remuneration. Yes, Northland has had issues, and we still have issues finding GPs, as you know, but actually other parts of the country do as well.
How will cutting the public sector help the country deal with the size of the population?
Well, what I'd just say to you is we are asking the public services and the public government agencies to make sure that they are spending their money very efficiently. We want to make sure that all money available is actually being deployed into the front line as best as possible. We do not want it sitting in bureaucracy. We do not want it on waste. We do not want dumb and stupid projects being wasted on. And we actually want to make sure the back offices of these functions and these agencies are working very, very effectively, very efficiently. We want to then recycle that cash, make sure we deliver frontline services, and we stop the wasteful spending that's been going on.
Where are you at with the public sector cuts?
Well, the public sector savings is what we're driving here, because we're actually wanting to make sure that we get rid of the backroom office, all the contractors, all the consultants. We're going to have a quarter reduction on contractors and consultants, and as I said, make sure the back office functions and the bureaucracy is cut out of the system, because we want that money freed up to be deployed into the frontline services. So let's be clear about what we're talking about here: public service savings. And we're working our way through that now as we go into the budget in May. All those agencies are now coming forward with their savings plans and how they think they can generate and hit those targets for us.
What in your 100-day plan will deal with the population growth and the pressure that puts on public services and infrastructure?
Well, look, I mean, we talked a lot about infrastructure development in this country. The first thing was to remove the RMA 2.0 of the previous legislation from the previous government, which was slowing this country down. We've seen a huge growth in resource consents. It's at $1.3 billion being spent on resource consents this year, each year. We've seen almost a doubling of the time it takes to get anything consented in this country by 5 years. Totally, utterly unacceptable in a modern, small, advanced country like New Zealand. Not acceptable. So what we're doing, as you would have seen yesterday, announced fast-track consenting. That's important. Why? Because all of a sudden it means we can open up a new road that enables a whole bunch of new houses, a whole bunch of new schools and hospitals and communities to be created in order to deal with growth. But at the moment, you can't have growth and not have a really old way of running infrastructure, which is what's been our experience in New Zealand over a number of years.
Why haven't you backed away from a promise to build a new hospital in Whangarei?
Well, we haven't. I'll let Shane talk to that.
Thank you. We remain committed to a new hospital upgrade in Whangarei. Let's remember there are two tranches. Tranche 1, 2022, was $750 million for the acute services block. Tranche 2 is for the tower block. Where that currently sits is with the current local people and with Health New Zealand figuring out the detailed business case. So the next step in this journey, if you like, is the detailed business case for the tower block. And I'm hopeful that we'll receive that this year.
So you're supportive of it?
Was supported from day one.
What's different about these targets compared to the metrics that Te Whatu Ora already reports on every month?
So you can report something, or you can have a focus on it, and you can have an implementation plan that actually delivers it. So as I said in my opening address, they're tried, they're tested, they've been established for a while. Because they're the right targets. Why would I want to create something that's sort of just for the sake of a new target? So they've been around for a while. We just want to have an implementation plan that does a better job and be more ambitious, actually driving the system towards those targets.
Prime Minister, are you concerned about the job cuts announced by, proposed job cuts announced by TVNZ?
Yeah, look, I mean, I just want to acknowledge pretty tough time if you're a TVNZ employee as that business is restructuring to deal with the reality that it has, which is that, as we're seeing in media companies and media organisations all around the world, here at home in New Zealand, but also around the world, it's a pretty tough time. And what's fundamentally happening is structural change in that sector. Consumers are consuming their media in very different ways than they have traditionally done so through TV, press and radio. As we've got more digital media happening, you're also seeing advertising models and revenue models breaking down, and as a consequence, media organisations need to innovate and evolve in order to build new business models that deal with a future that's going to be increasingly digital media. But having said that, I just want to acknowledge that it's a pretty tough time, obviously for people working in media, hearing the news and going through any restructure. I'd also like to say, though, that over the last 2 years, Shane and I have travelled this country and we've met many other companies and organisations in many other sectors that have also had to lay off workers because of economic mismanagement that causes tough times like this, which means people lose their jobs. And when you don't manage inflation, and that drives interest rates high, and that then slows the economy down, and then unemployment starts to rise. That's the story of economics, and that's why our government is so frustrated with the efforts of the previous government and the economic mismanagement that we've now inherited, and that's why we're working so hard on the root causes of taking inflation down. If we get inflation down, we get interest rates down, businesses can borrow and invest and grow the economy and therefore keep people in employment. That's how it works.
Minister Lee said that there's work being done on a cabinet paper to try and come up with some sort of solution or some way of helping the media sector cope. When could we expect that?
Well, look, I want to be really clear. The government already supports things like New Zealand On Air, but we are not interested in owning more media assets. That is not the way forward in a democracy, to have governments owning media. That is not a good outcome. So we will continue to support state broadcast media as we have done, and as many governments before us have done. But I want to be really clear. It's unlikely that we're going to have any further ownership of any media assets. I acknowledge that the media companies are doing it tough because they're having to evolve to a different set of realities as consumer habits have changed, and that is happening across the economy. It's happening across a number of sectors. I have no doubt that they will ultimately be able to innovate. What is important to me is that there maintains a plurality of media voices in this country, which actually is the case. It may not be in the traditional form of TV, print and radio, but there is a range of media voices, whether it's regional or in our cities, ethnic media, right through to mainstream media. So we want to make sure that plurality of media stays in place.
Could TVNZ be commercial free?
Again, those are conversations we can have in the future, but the reality for us is actually, I think the commercial model for TVNZ has been a good one in terms of keeping it on point and has built a very good culture inside that organisation. So, again, those are conversations a long way down the road, but actually it's up to each media organisation to deal with the reality of changing consumer habits. And I know that's incredibly difficult, but I just say to you, it's happened in many of our other sectors across New Zealand's economy as well, as countries and as companies are wrestling with what has been economic mismanagement in this country over the last 6 years.
Do you view these layoffs as damaging to New Zealand's democracy?
Well, I actually think about the people that are impacted because that's incredibly discombobulating. It's really unsettling for those employees and their families. That's what I'm thinking about, and I know that that's difficult. Again, not just in media. You have to understand there have been many companies over the last year and a half that have had to unfortunately lay off a lot of workers, and I've seen that up close over the last year and a half. I've been talking about it as I've been travelling. I've been talking about it with the media as I've been talking about these other instances of other companies and other sectors doing it tough as well. So, really, it's an unsettling time. We get that, and it is happening because media companies need to evolve and innovate in order to deal with changing consumer demand.
Have you spoken to David Seymour about his TVNZ comments?
Look, I haven't, but again, I just want to acknowledge it's a pretty unsettling time for TVNZ employees and also News Hub employees at this time.
Separately, have you shifted away from a focus on childhood obesity and smoking time?
No, not at all. We are determined to see daily smoking continue to come down. It was incredibly encouraging to see the latest set of numbers over the last 12-month period go from 8.6 down to 6.8%, almost another 2% drop. We believe going back to the existing legislation, which is what we currently have had in effect, actually will help us deliver that. Over the last decade, daily smoking rates have dropped from 16.7 down to 6.8% in just over a decade. So we know that there's a lot more work for us to do, but to get to 5%, our smoke-free target, is really important to us, and that's going to continue to work very hard on that.
On these first 100 days, are you happy with your government's use of urgency, heavy use of urgency to push these things?
Absolutely, because we're under new management in this country, and we are here to grow this country, and we want to have more ambition and aspiration. And what was happening before was not working. We talked about it for the last year and a half. I was very upfront with the New Zealand people and with all of you about what we're going to do. We campaigned on it, and now we're doing what we said we would do. And I'm incredibly proud. I said to you, I'm not afraid we're going to turn this country around, and that means we are going to have tough choices from time to time, but we are going to make decisions, and we are going to say hard yes, hard no to things in order to move things forward. The country has had too much talk, too much inaction, too much spending, a deterioration on every single outcome, whether it's been crime, health, education, the economy. It's all gone backwards, despite having spent an 84% increase in government spending, despite having added 16,000 more public servants, despite having driven debt from $5 billion up to $100 billion. The debt alone now costs us $8 billion a year just to service the interest costs on the debt. That is more than we spend in primary and secondary school education, period. So we need new management. New Zealand is open for business. New Zealand is we have a great future ahead of us, and we are determined to realise the potential in this country. But it means we will be doing things differently. We cannot carry on doing things the way we've been doing things over the last 6 years, which have been a complete lost 6 years for New Zealand. When you see other countries that have taken off around the world, we need to do exactly the same. So we are focused on building back a world-class education system. We want modern, reliable infrastructure. We need to embrace more science, technology and innovation. We need to get rid of the red tape, and we need strong international connections to the world. And that's why I've brought new energy, new engagement and new intensity to actually building our relationships back across Southeast Asia, Northeast Asia, with Australia, into the Pacific as well.
Do you still expect to do quarter 2 and quarter 3 plans?
Yeah, we will. We'll work on that soon. But today is really a day where I think we have hit, as a new government, a coalition government of 3 parties, working in a completely new and different way. What we have achieved in the first 100 days is something to be incredibly proud about for all of our team. And it's not just our ministers and our cabinet and our respective MPs that have driven it all. It's also the officials that sit behind it who have actually responded incredibly well, partnered with us incredibly well as new ministers coming in, and there's been some phenomenal outcomes. When you look at what we announced yesterday on fast-track consenting, one-stop shop consenting, that's a 2-year piece of work that we did in 2 months. And that was only possible because we had amazing officials working incredibly hard on all of that. When you think about the work that Shane did before Christmas to make sure that we actually got security into our hospitals so we could protect our emergency department nurses. Well, we've been talking about that for the last 2 years. We can keep talk as much as you like, but you've actually got to make a decision, actually do something. And Shane and the officials found a way to do it. And lo and behold, we halved the number of incidences that happen in some of our hospitals up and down through the summer period. So, there are small examples. We could say things like banning mobile phones. Initially, the officials can say, Minister, that will take a year. We need to think about that. We need to consult with a bunch of people. No, we don't. We want that ready to go, not next year. We want that ready to go the first day of school this year. And lo and behold, principals, parents, teachers, kids, what are they saying? Noise levels in lunchtime are up, less cyberbullying, and the phone policy is working fantastic. Same with an hour of maths, an hour of reading, an hour of writing going in. Now, we could take a long time to do that, or we can jam it in like we did. So I just want to say to all the officials, all the public servants that have supported us, who've got on board with the clarity that we're providing around the things that are important, thank you, because it's made a big difference.
Well, we have to focus on cancer care. Just one last question.
Yep, sure.
Any word on when those 13 promised cancer drugs will be funded?
So as you recall, part of that was bringing in the copay, which was the funding mechanism. So we're needing to do that. We're not far away, just a little bit of information technology to try and make it easy for pharmacists who we'll collaborate with. So we need to do that first, and then we'll look at the cancer drugs.
Great. Can I again say thank you so much for coming out today, really appreciate it, and hopefully you got a sense that we are wanting to do things differently. I appreciate it. We're not afraid to make the tough choices. We need to get the country moving. We want to turn the show around. We've got a great future, but we've got to go out and make it happen. Thanks so much. Appreciate it.